Okay, we're gonna do the muscles of the shoulder girdle and then the shoulder joint. So let's do the shoulder girdle muscles first. In the sitting position, I'm gonna palpate 3 muscles. I'm gonna palpate the upper trap, the levator scapula, and the serratus anterior. So the upper trap is a superficial muscle located on the posterior aspect of the trunk. You could say the neck and shoulders, any of those are fine. So when I think about the upper trap, I'm thinking about it coming from here and going out to the outside of the shoulders. So it's really kind of where you would feel like the top of your shoulders. So I'm gonna stay right in this area, put my finger here, and I'm gonna ask my patient to go ahead and shrug their shoulder up. You should feel that muscle contract and come back down. The levator scapula is a muscle that is deep to the upper trap, so that's how I'm going to describe it. I'm not going to be able to identify this muscle by palpating it because the upper trap's going to be contracting as well. But I'm going to use my anatomy. So I know that it starts up at the C1 through C4 transverse processes, and it comes down and inserts around that superior angle of the scapula. So if I think about that muscle, it's not a very thick muscle. Think of it running like strings from here to here. It's going to be a muscle that's deep in that area. So it's a deep muscle located on the posterior neck or posterior thorax. And I'm also going to have the patient go ahead and shrug their shoulders. So anywhere in here, I shrug, and I'm going to put my finger, and that's going to be the levator scapula. The last muscle in sitting is going to be the serratus anterior. So the serratus anterior is kind of tricky because there's a lot of muscles over there, but if you describe it on the most lateral aspect of the trunk, you could say it's a superficial muscle, and its major action is shoulder protraction. It's also an upward rotator. So I'm going to go ahead and have my patient put their arm out, and I'm going to think about my anatomy. It's going to be right in that lateral area. So remember, your lats are back here, you got your abs, so stay as lateral as you can, close up here to the axillary area, and then I'm going to ask my patient to go ahead and push like they're punching forward, and that's going to be where that muscle is located. Go ahead and relax. So remember, when you're doing these 3 muscles, that you're also talking about their main action. So we said elevation, but they also are upward rotators or downward rotators. So the upper trap and the serratus are upward rotators, and that levator scap is a downward rotator. Now I'm going to have my patient go into the prone position. So we could do the mid trap, the lower trap, and the rhomboids. So the other two traps are going to be, again, superficial muscles, because the trap, if you remember, runs in this whole area here. So go ahead and bring this arm off to the side. I'm going to do the mid trap first. The mid trap is a superficial muscle located on the posterior trunk or the posterior thorax. It does shoulder retraction. So what I'm going to do is find that scapula. I'm also going to know that that muscle, where it originates in this area and then it runs over. So I'm going to stay up high, right around like C7, come down just a little bit, and then you're going to come just lateral over the spine, and I'm going to ask my patient to go ahead and retract. So go ahead and lift your elbow up towards the ceiling and squeeze your shoulder blade, and that's where the mid trap is going to be. Go ahead and relax. The lower trap is going to be, don't go too low on this, right? So, because remember, it comes back up to the scapula. So I'm going to come down and think about it being in this area here, coming down by T12. So it's also a superficial muscle located on the posterior aspect of the trunk. So your actions for the lower trap are going to be upward rotation, depression. So I'm going to ask my patient, just like you do for your manual muscle test, to bring that arm out into the Superman aspect. So go ahead and bring your arm out that way. And then I'm going to ask them to lift up, like thumbs up, and lift up towards the ceiling. And then I should feel that lower trap kind of come into my finger right there. Go ahead and relax. So it helps with retraction, it helps with depression, and it also helps with upward rotation. You want to make sure you know all the actions of that. The last muscle is the rhomboids. So go ahead and bring your arm back down. So we're going to just talk about the rhomboids is a downward rotator, and it also does some retraction and depression. But the rhomboid is that muscle that has kind of a different way of manual muscle testing it. The rhomboid is deep. So I'm going to go in the same area as the mid trap, knowing that that rhomboid is running this way, and I'm going to ask my patient to do, if they can, I'm going to ask them to put their hand on the small, because it's the small of their back, find that scapula, come a little bit medial to it, and say that it's a deep muscle located on the posterior aspect of the trunk, and I'm going to ask my patient to go ahead and lift their hand up and I'm going to find that muscle there. Remember, these muscles are all contracting together, but I'm using my anatomy to know that that muscle is in there. It's just deeper.